So I think it was at the end of 2013 into the beginning of 2014, and my dad has a cancer illness, and we had learned that it had metastasized, and dealing with all of the sort of the emotional responses to that. Me being a clinician and a daughter, it was an interesting thing for me to sort of navigate and figuring out how to behave, because he would ask me questions about the medical components of his illness and sometimes share some of the emotional things, but I'm also far away. He's in Colorado and I live in Massachusetts. So it was during that time that sort of just processing all of that and going through that experience and really sitting down and thinking about what was I really struggling with the most. And when I thought about the eventual passing of my father, what I was most upset about was not being able to hear his voice anymore. And so that sort of spurred this on. I've always been a fan of StoryCorps, and I'm a huge NPR nerd, so I listen to StoryCorps on Friday mornings. And so I had a little bit of time in between leaving my last position and starting with Norwell VNA, and had really sort of played with this idea, but didn't know what I was going to do with it in terms of connecting with StoryCorps. And this really started in thinking about how could I do this with my dad, and looking in terms of they have traveling recording booths that go across the country, and then their recording studios. And it really didn't seem like that was going to work out so much. And then getting into my work, thinking about what my patients and their families are facing, and also what the clinicians who take care of them are facing, and being able to offer an experience that was more about them as a person and less about them in terms of the medical model and dealing with only their medical needs.